Today's big question: what is the healthcare system like in Ghana? If you're looking to travel to Ghana, or you live there now, or you're just curious about the country, then this video is for you. We'll look at the state of emergency in healthcare that was declared in 2021, how much healthcare professionals are paid, Ghana's innovative digital health ID card, and what it means for medical tourism. And we'll look at some of the other challenges facing the healthcare system in this West African nation of 32 million people. Let's get into it. In September of 2021, Ghana's President Nana Akufo-Addo declared a state of emergency in the country's healthcare system due to a number of issues that were putting a massive strain on the country's ability to care for its citizens. These included a shortage of healthcare workers, especially those with specialized skills, a lack of supplies and equipment, long wait times, difficulties accessing healthcare facilities, a brain drain of healthcare workers, leaving for more lucrative opportunities abroad, and an aging healthcare infrastructure. But the main issue facing the country is that there are not enough hospital beds per capita to properly serve the population. For example, in the United States, there are approximately 3.1 hospital beds for every 1,000 people. In Ghana, there are only about 6 hospital beds for every 1,000 people. This shortage has led to overcrowding in hospitals and clinics, making it difficult for patients to receive the care they need. The situation is especially dire in rural areas where access to healthcare is already limited. So let us take a look at the healthcare system in Ghana from top to bottom to see what the problems are. Just a quick reminder before we begin that the information contained in this video is for educational purposes only and should not be considered medical advice. The government of Ghana has put a lot of effort into trying to make sure that all citizens have access to quality healthcare. The country has a 3-tiered healthcare system that is designed to provide care to everyone in the country. The first tier of the healthcare system in Ghana consists of a network of community-based health planning and services that serve as the first point of contact for many citizens seeking medical attention. These facilities, which include clinics and health centers, are typically staffed by trained nurses and midwives who provide a wide range of primary healthcare services such as immunization, paternal and child health care, as well as treatment for common illnesses and injuries. The next tier of the healthcare system in Ghana comprises district hospitals that provide more specialized care than the community-based facilities. These hospitals are usually located in major towns and cities and are equipped to handle a wider range of medical conditions, including those requiring surgery and other advanced medical procedures. The third tier of the healthcare system in Ghana is made up of regional and national hospitals that provide the most comprehensive and specialized care in the country. These facilities are often referral centers for the district hospitals and are equipped to handle even the most complex medical cases. As far as funding goes, the government of Ghana spends about 4.6% of its GDP on healthcare, which is a bit less than the average of 5.5% of GDP that is spent on healthcare in low-income countries. About 2/3 of this funding comes from government sources, while the remaining 1/3 comes from a variety of external sources, including donors and development partners. Despite these efforts, however, access to quality healthcare remains a challenge for many Ghanaians, particularly those living in rural areas. This is due to a number of factors, including the country's high levels of poverty, which can make it difficult for people to afford transportation costs to reach health facilities. Additionally, the shortage of healthcare workers and facilities in rural areas makes it harder for people in those areas to receive the care they need. So what does this mean for expats and foreign nationals living in Ghana or visiting for medical care? Well, if you're an expat or foreign national who requires medical care in Ghana, it's important to note that the quality of care you receive will vary depending on several factors, including the type of facility you seek care from, your ability to pay for services out of pocket, and the availability of specialists and equipment. Overall, Ghana's healthcare system faces significant challenges, but there are still options for those who require medical attention. However, due to the strain on the healthcare system, it's best to come prepared and have medical insurance that covers any potential medical expenses. One of the exciting developments in Ghana's healthcare system is the introduction of a new digital health ID card. This new card, which is being rolled out to all residents of Ghana, will contain a person's complete medical history, making it easier for healthcare providers to access important information when needed. The Digital Health ID card is part of a larger effort to improve the quality and efficiency of healthcare in Ghana. By giving healthcare providers access to patient records, the government hopes to reduce errors and improve coordination of care. It also hopes that this new card will help to eliminate the problem of people traveling to neighboring countries like Togo and Benin for medical care, as the card will enable Ghanaians to access quality care closer to home. One of the key benefits of the Digital Health ID card is that it will make it easier for patients to travel with their medical records. In the past, patients had to carry around bulky files containing their medical history. This not only caused inconvenience, but also posed a risk of losing or damaging important documents. With the new card, patients will be able to travel light, knowing that their complete medical history is stored electronically and can be accessed by healthcare providers anywhere in the country. This will also make it easier for patients to seek medical care while traveling, as they will not need to carry around their entire medical file. Instead, they can simply present their Digital Health ID card. The government hopes that these changes will make healthcare more accessible and efficient for Ghanaians, ultimately improving the overall quality of care. In recent years, Ghana has made significant progress in improving access to healthcare for its citizens, according to the World Health Organization. Life expectancy in Ghana has increased from 57 years in 2000 to 73 years today. Additionally, the under-5 mortality rate has decreased from 93 deaths per 1,000 live births in 1990 to 44 deaths per 1,000 live births in 2020. Despite these improvements, however, challenges remain, according to the WHO. Only 58% of Ghanaians have access to basic health services, and only 28% have access to essential medicines. Additionally, there is a shortage of healthcare workers in the country. For example, there are only 11 doctors for every 1,000 people in Ghana compared to the WHO recommended ratio of 20 doctors for every 1,000 people. This shortage has led to long wait times for medical services and overcrowding in hospitals and clinics. The government is taking steps to address these challenges. In fact, in addition to the Digital Health ID card, the government has launched a number of initiatives to improve access to healthcare, including the National Health Insurance Scheme, which provides health insurance to all Ghanaians, and the community-based health planning and services, which aims to improve healthcare delivery at the community level. The government is also investing in training more healthcare workers and building new hospitals and clinics. Now let's talk salaries of healthcare professionals in Ghana. How much do doctors and nurses make in the country? Doctor salaries in Ghana range between 1,600 cedi to 15,000 cedi, with an average annual salary of 5,200 cedi. Entry-level positions start at 1,600 cedi, while most experienced workers make 15,000 cedi per year. On average, doctors in Ghana earn about 50% less than the average salary in the country. However, the median salary is still higher than the minimum wage in Ghana, which is 1,600 cedi per month. Nurse salaries in Ghana range between 986 cedi and 13,000 cedi, with an average annual salary of 3,892 cedi. Entry-level positions start at 986 cedi, and most experienced workers make 13,000 cedi per year. On average, nurses in Ghana earn about 35% less than the average salary in the country. However, the median salary is still higher than the minimum wage in Ghana. When it comes to the cost of healthcare in Ghana, it really varies depending on where you go and what kind of care you need. If you're looking for general medical advice or treatment for minor ailments, you could easily spend between 50 and 150 cedi. If you need to see a specialist or get a prescription for medication, expect to pay between 150 and 300 cedi. More complex procedures and treatments, such as surgery, can cost several thousand cedi. It is important to note that the cost of healthcare in Ghana can be quite burdensome for some people, especially those living in rural areas or on low incomes. Many Ghanaians rely on the country's public healthcare system, which is often overcrowded and understaffed. While the government has made efforts to improve the quality and accessibility of healthcare for its citizens, challenges remain. Hopefully, the new Digital Health ID card and other initiatives will help to improve the situation. Alright everybody, that's all for now. Thank you so much for watching this video about the healthcare system in Ghana. Please remember to leave a comment below with your thoughts. Don't forget to subscribe for more videos about global health and medicine. Please support us by clicking the link in the description. Till next time, stay healthy, stay safe.